Thanks for joining me. In this video, I'm going to do more talking than walking. I want to spend a little time discussing one of the most critical walking technique mistakes that anyone can make. It's a mistake that I made in the past, and I was super lucky to ever be able to fix it. It's such a bad walking technique mistake that even after all of these years of teaching walking technique, I can't help somebody fix this mistake. But I can talk about it. So if you're a returning viewer, you can relax your brain a little bit. I'm not going to do any core movement analysis. If you're a new viewer, especially if this is the first time you've ever clicked on a walking technique video, I want to thank you for joining me and tell you you've come to the right place. Now, some new viewers will post a comment like, "I can't believe I just Googled how to walk properly." But that dismisses the challenge that a lot of people have with walking technique. It's really common for people to have walking technique issues that end up causing pain. It's just that a lot of people don't recognize it. I think that almost any walking technique problem can be fixed, otherwise I wouldn't have this channel. But this specific walking technique mistake that I'm going to discuss today, even I can't fix. But if you stick around to the end of the video, I will guarantee that you won't make this specific walking technique mistake. Now, how do we know that walking is a problem for a lot of people? It really shouldn't be if you think about it. I mean, what could be easier than walking? We have phrases like a walk in the park that are supposed to imply that walking is an especially easy and pleasant thing to do, especially if you do it in the park. But how many people have problems with their walking? How many people get up every day and the first thing they experience when they put their feet on the ground is pain? Pain in the feet from plantar fasciitis or bunions, or pain in the knees from patellofemoral pain syndrome or arthritis, pain from hip arthritis, pain in the lower back, all kinds of different problems that cause people pain related to the way they walk. Now, you might think that most of these people have had some type of injury as the cause of the pain, but that's not true. At least not in the sense of an injury how we normally think about it. But in another sense, it is an injury that's causing the problem. It's an injury caused by the most frequent activity that we do each day, and that is walking. Incorrect walking technique puts a lot of stress on all of our joints that are weight-bearing over and over for 5,000 to 10,000 steps a day, millions of steps per year, each one causing a little bit of damage that over time can cause serious wear and tear and inflammation and pain. Somewhere along the way, I want you to drop me a comment and let me know what brought you here to this walking technique video. I'm a family medicine physician, so I see almost every medical problem under the sun. And one of the most frequent things that I see is pain in the weight-bearing portions of the body. The feet, the ankles, the knees, the hips, the lower back. Of course, I do see a lot of older patients who have pain and worn out joints, but a lot of patients are younger and are experiencing pain when they walk, and these people have had no specific injuries. It's the walking itself that's the cause of the problem. We know from statistics that almost 10% of the population suffer from plantar fasciitis. Plantar fasciitis is pain in the heel caused by little micro tears in the plantar fascia, which is the connective tissue connecting the metatarsal heads to the heel in the foot. There's a lot of treatments for plantar fasciitis, which include arch supports, stretches of the feet, stretches of the heel and calf, and sometimes even cortisone injections or other types of injection therapy. A lot of these treatments can be helpful in the short run, but no treatment is found to be helpful long term for plantar fasciitis. Why is this? Also, there's about 22% of the population that have a condition called patellofemoral syndrome. This is pain in the front of the knee under the kneecap that especially is common in younger people. Up to 28% of adolescents have patellofemoral pain syndrome. Just like with plantar fasciitis, the causes are really not defined very well, and the treatments are even less well understood. I remember a lecture from an orthopedic surgeon that I went to about 20 years ago, and he was addressing patellofemoral pain syndrome. And he said that it was a complex issue because in the early days when they would treat people, they assumed the problem was from weakness in the muscles, specifically the VMO, one of your quadriceps muscles. And that weakness causes the patella to track irregularly, leading to pain. So the treatment was exercises to strengthen. But he would see patients come in who were bodybuilders with a bulging VMO muscle, and he couldn't even get it out of his mouth to say, well, you've got to strengthen this muscle because it's weak. So then they broadened the idea out from just being weak muscles to possibly tight muscles. So you could either strengthen weak muscles or stretch tight muscles to try to help fix the problem. But even that never really worked very satisfactorily long term for most people. Why is that? Well, the problem, in my opinion, is that weakness and tightness are not always the problem, or not even mostly the problem, because you'd have to wonder, why is something becoming weak in a healthy person, or why is something becoming tight in a healthy person? The problem that I believe is usually missed is walking technique. A lot of people don't walk correctly, and that causes extra stress on the feet and on the knees and on all of the joints in the body. Those added stresses can lead to pain. But we would never know it if we don't analyze somebody's walk when we see them in the exam room. And I know most all physicians don't do that. Some physical therapists or chiropractors will evaluate people's gait, but from a physician's perspective, this is generally always ignored. I find it a little funny because you always hear that physicians have had no training on nutrition. I can't count the number of lectures I've been to over and over again on nutrition and new research in nutrition. We learn about nutrition all the time. But I have never heard a lecture on walking technique, how normal people should walk properly. It doesn't exist in the medical field. So that is something that is really missing, and it causes a problem because people go to the doctor with problems like plantar fasciitis, patellofemoral pain syndrome, which may eventually lead to wearing out in the whole joint, which we would call arthritis. They come to the doctor seeking solutions for these problems, and we get things like arch supports, stretching, strengthening, but if we're missing the fundamental problem of poor walking technique, then we're never really going to fix the issue. Now, this is where I want to get to the most important or critical walking technique mistake that anybody can make. And that is being unaware that walking technique can be a problem and has a very specific way that it needs to be done to reduce impact on the joints and to keep your spine properly aligned. The fact that you've stuck with me to this point after clicking on the video means that you have some awareness that walking technique is important. So give yourself a round of applause because you've taken the first step. I believe that a lot of problems like duck feet or leaning forward when people walk can be corrected first and foremost just by understanding that they're problems. Now that you're aware that walking technique is important and can be a problem, it's going to be so much easier for you to fix any problems that you have. So if you're experiencing or have experienced any type of pain in your weight-bearing joints that was not caused by an injury, something that came out of the blue unexpected, you can almost guarantee that there's something in your walking technique that was a problem. And you need to try to figure out what that is so you can fix it. Let me start off just by giving you a few tips that you should be looking out for. Firstly, vertical posture. When you're standing, you should be not leaning forward, not leaning to the side, spine completely vertical. We do not need to lean forward to start moving. A lot of people have that misconception. So stand straight, stand tall, eyes gazing forward. Also, make sure that your arms are swinging in opposition to your legs. So when your right arm is going forward, your left leg should be going forward. It shouldn't be swinging across your body this way. It's straight forward and also not swinging too far back. It should be going forward with the opposite leg and then dropping back to a neutral position as you cycle through each step. We also want to make sure that our pelvis is kept in a level position, not tipped forward or not tipped back. This may be hard for you to recognize, but if you're having issues, seeing a physical therapist may be able to help that issue because they'll be able to evaluate that for you. Also, something that anybody can notice for themselves is the position of the feet. Your feet should be facing directly forward when you're walking and not turned out to the side. So if you notice your feet are turned out, which we refer to as out-toeing or duck feet, you can try to consciously bring them back in line when you're standing up, at least at first, and then gradually start trying to see if you can straighten them out as you walk. Now, if there are challenges that you're having with your walking technique that aren't immediately fixable just by being aware of them, that's where my videos come in. I have videos that can try to help you understand the patterns of core movement that we all use to walk correctly. The patterns that we use in the core direct the way our arms go and they direct the way our legs go. So we have to fix the movement of the core in order to fix any problem with the legs and with the arms. That is a little harder to do than just being aware of the issue. So I do recommend, if you're having persistent problems, study my videos and work on the techniques that I describe that should be able to help anybody improve their walking technique. I'm a tango dancer, and as I said earlier, I made this specific walking technique mistake myself in the past. Even though I was a trained dancer, I was walking incorrectly. I was leaning forward, crashing into my heels. I was told that I had flat feet. I was wearing out my shoes on the inside all the time, and I thought it was just the way my body was built. I really thought I was just a fast, productive walker. But even my nurses at the clinic would say, "Oh, Dr. Martin, I can always tell when it's you coming around the corner," because they could hear my loud, hard heel strikes. This wasn't just a benign issue. Had I not fixed it many years ago, I'd be ending up with pain right now. I was lucky that my wife pointed out that I had a walking technique problem as we were walking hand in hand down the street one day about 15 years ago. She yanked her hand out of mine and said, "Stop holding her hand," because I was yanking her forward, pulling her shoulder, because I was leaning forward. Now, I didn't believe her at first, but after a couple more tries of holding her hand and her yanking it away, I realized that there was an issue. And then I started to think about the way I walked more like the way I danced, and applying some thought to the process of walking, I was able to fix the issue. I think if you think about walking technique like a dance, you're really going to help improve the way you move. Think about it this way. What's the difference between walking and dancing? Well, in dancing, we usually move to music as opposed to walking, but that's not really a difference. You can always turn music on while you walk. Another difference is that when we dance, we're usually trying to do a specific movement, a specific type of dance move that we know what it looks like, and we are trying to emulate that look. But in walking, we tend to be unconscious of what normal walking technique is supposed to look like. We don't even think about it. Most people who duck foot walk have no clue they're even doing it. They've never given it a second thought. But if it was like a dance and you were trying to emulate a very specific, flowing, nicely aligned movement with low impact, and you knew what that looked like, the way you walk could become like a dance. And you can train your walking just like you would train yourself to do a dance. It's not that hard. It just takes a little bit of effort and time, and then you can do it. So if you have any problems with the way you walk, try to think of your walking technique as a dance and put some time over the next few months watching my videos, learning some of the techniques that you can use to improve the way you walk, and I think you're going to get a lot out of that. Go ahead and leave me a comment. Let me know what brought you here to this video, what you think of my analogy between dancing and walking, and what you plan to do about your own walking technique. One of the things that you can do to help everybody is get these videos out in front of more people. All you have to do that is leave me a comment, click on the like button, and subscribe to the channel. That's going to help YouTube know that this is important content and ship it out to more people. So the awareness of walking technique issues becomes much greater than it is right now. If we can do that, it might be the most important thing that anybody can do to help reduce people's pain in the long run. So thanks for joining me, and I'll see you in the next one.